Newborns are totally and completely dependent on their caregivers. They cannot talk to tell us their needs. However, scientists have found that babies do have some pretty amazing ways to communicate what they want and need. A baby's unique language can tell his caregivers when he's hungry, when he is scared or lonely, when he needs to be comforted, and when he just needs to be close. Learning this language can take a little time and patience, especially since babies' cues are a little more subtle right at first. When parents room in with their baby and stay close in those early hours and days, they're able to learn these wonderful cues. The hospital stay is the perfect time to begin while help is near. Researchers have found that there are 2 actions that a baby's caregiver can take to help the baby develop trust. Those 2 things are feeding him and responding to him when he cries. When babies are held closely and fed, they learn to trust that their needs are going to be met. They learn that someone cares, and these patterns of trust form the foundation for a lifetime security. When babies are still in the protective environment of the womb before birth, they're used to constant nutrition coming from the placenta. They have never known what hunger would feel like because their tummy was always full. They floated around in amniotic fluid and could take a swallow or 2 anytime they wanted. Once they are born and the umbilical cord is cut, that constant stream of nutrition suddenly stops. While they're getting used to lots of new skills like breathing on their own, babies also now have to figure out what hunger is and how to get their needs met. Babies will want to feed very often in the first few days while they're learning these new skills. Fortunately, the milk mom makes right at first is exactly what the baby wants and needs. Mom's colostrum smells just like amniotic fluid, and it comes in very small quantities, about a teaspoon at a time, which matches the size of the baby's stomach and is closer to the amount baby took in while he swallowed amniotic fluid. When parents keep the baby in the mom's room, they can begin watching for these early signs that the baby will give them to show them that he's ready to be at the breast for quick feeding or for comfort. This helps baby gradually get used to learning how to feed properly and how to get used to spacing out his feedings a little more. Soon, he won't need to eat quite so often. When the baby is in a nursery, parents miss these important cues, and the baby feels utterly alone, away from his mother, trying to make sense of the new and scary sensations he is encountering. This is one reason babies kept in a nursery cry more. Keeping the baby close helps parents learn their baby so they can help the baby feel secure, knowing he is loved and cared for. Parents can watch for the earliest cues, the signs that baby is getting ready to want to be at the breast. These might occur while the baby is still sleeping. He might be wiggling or tossing or turning, or even making some mouthing movements like sticking out his tongue or licking his lips. This is the perfect time for mom to hold the baby skin to skin, so when he's ready, he'll have instant access to the breast. If these getting ready cues are ignored, however, baby will start to intensify his behavior. He's starting to feel a little frustrated now, so he might frantically suck on his hand if it's near his face and turn toward anything that comes near his mouth. He may turn his head rapidly from side to side or suck on his hands and fingers. If these more intense cues are ignored, the baby will become very agitated. He will make louder noises and grunt. His face might turn red. His stress levels are now rising, and he is telling his parents, "I need help here." If these cues are ignored, baby will become extremely distressed and begin to cry. Cry is a sign of distress. It's baby's way of saying, "Someone, rescue me, save me." When a baby becomes this distressed, he also becomes disorganized, and he doesn't know quite what to do. His arms and legs might flail about. His face will be bright red, and his heart rate has gone up. It might take 20 minutes or so for the stress levels in his body to leave his system. That's why it's best to try and calm the baby by holding him skin to skin for a while before trying to feed him. If parents wait until the baby is this mad before trying to feed him, babies will soon stop giving those earlier cues. That's because they're learning quickly that the only way to get their needs met is to cry.